Hello, I'm Dr. James, and today we need to talk about something crucial. Did you know that over 70% of strokes in older adults happen at home, and that most give warning signs hours before they strike, yet almost no one recognizes them? It's true, a stroke rarely occurs without warning. The real problem is that these crucial signals are often dismissed because they seem insignificant. A momentary dizziness when standing, a fleeting numbness in an arm, or slightly slurred speech. Too often, people think, "It's just fatigue, it's my age." But that's a dangerous misconception. Stroke today is the leading cause of physical disability among the elderly. Even more unsettling, according to the World Health Organization, 1 in 4 adults will experience a stroke in their lifetime, affecting over 15 million people globally each year. The good news is that a significant majority of these cases could be prevented with better information and attention to early signs. And here's something almost no one talks about. Many of these critical symptoms appear at night or in the early morning hours. This is when blood flow naturally slows, blood pressure can fluctuate, and the body becomes more vulnerable. That's why, in this video, we're going to uncover the 7 most ignored signs of stroke in older adults. These are signs that often manifest quietly, but they can be the only warning before a tragedy strikes. I urge you to watch until the very end and share this information with those you love, because knowing these signs truly can save lives. Our first sign: difficulty with speech or understanding what others are saying. If you wake up and notice your words aren't coming out as usual, or they sound garbled, be very alert. This is one of the most common signs of stroke, especially in older age, and often occurs in the early morning when cerebral circulation is still sluggish from nighttime rest. Alternatively, someone might be talking to you, but you can't grasp what they're saying. Phrases seem nonsensical, or your brain processes them too slowly. This disturbance in speech or comprehension might only last a few minutes, which is why it's frequently dismissed by people over 60 as something temporary. However, according to the U.S. National Institute of Neurological Disorders, these speech changes are among the earliest symptoms of an ischemic stroke, the kind caused by a blocked artery in the brain. With age, particularly in later life, the risk of stroke increases significantly as the brain becomes more vulnerable to pressure and blood flow fluctuations, especially during sleep. So, if this happens to you, even if it passes quickly, do not treat it as normal. Seek immediate medical attention, because when the brain stops transmitting signals, time becomes the most critical factor. Our second sign: sudden weakness on one side of the body. If you're an older adult and have woken up feeling strange in your leg, a weakened arm, or as if one side of your body is just off, do not ignore this. Such sudden weakness, affecting only one side, typically an arm or a leg, is a classic sign of stroke and frequently appears in people over 60, often right after waking when the body is still adapting from rest. The danger is that many older individuals dismiss this as a normal part of aging, attributing it to how they slept, their sleeping position, or even a drop in blood pressure. But when the weakness is asymmetrical, meaning it affects only one side of the body, it usually indicates that the brain is suffering from a lack of blood supply. According to the U.S. Centers for Disease Control and Prevention, over 80% of ischemic stroke cases are accompanied by this unilateral weakness, and it might only last a few minutes before disappearing. However, this doesn't mean everything is fine. In fact, it could be a transient ischemic attack, a small warning before something far more serious. Therefore, if you are elderly and notice that your leg gave out or you couldn't firmly hold a glass, even if you felt better afterward, please take it seriously. In older age, the window between a warning sign and a full-blown stroke can be very short, and every lost minute truly matters. Symptom number 3: sudden blurred vision, or partial loss of sight. If you're over 60 and have woken up with impaired vision, everything blurry, with dark spots, or feeling like your world has become distorted, this absolutely warrants your attention. While changes in vision over time are common in older age, when these changes happen suddenly, without explanation, and especially affecting only one eye, it could be a sign of a stroke. A stroke often affects areas of the brain responsible for vision, leading to partial field loss, double vision, or a sudden darkening of sight. According to the World Health Organization, these types of visual disturbances are present in a significant number of elderly stroke patients and can be mistakenly attributed to common age-related issues like cataracts or simple eye fatigue. However, there's a clear distinction. These symptoms typically appear abruptly and often disappear within minutes, which can be quite confusing. If this has happened to you, even if your vision returned to normal, do not ignore it. Your body might have recovered, but your brain could be sending out a distress signal, asking for urgent help. Symptom number 4. Sudden dizziness and loss of balance. In older age, a mild feeling of lightheadedness when getting out of bed might seem normal. But when dizziness appears suddenly, intensely, accompanied by a loss of balance or unsteadiness while walking, it's an alarming sign. Many elderly individuals describe this sensation as if the ground has given way beneath them, their body swaying, head spinning, and steps becoming uncertain even when standing still. This can indicate that your brain is experiencing a lack of oxygen, and in a stroke, the region responsible for balance is often one of the first to be affected. The World Federation of Neurology states that such symptoms are characteristic for individuals over 60 and frequently manifest in the morning when blood pressure is still stabilizing. The common issue is that many mistakenly associate this with inner ear problems or simply dismiss it as another sign of aging. However, dizziness caused by a stroke is different. It usually occurs very abruptly, may prevent you from walking in a straight line, and in some cases is accompanied by nausea or distorted vision. If this has happened to you, even if it passed within a few minutes, please take it seriously. In older age, what might seem like a minor balance disturbance can truly be the initial step towards a much more severe problem. Now, for symptom number 5, a sudden, severe headache, unlike any you've ever experienced. Have you ever felt such an intense headache, so sharp, that it felt like something was tearing inside your head? This isn't a typical migraine, nor is it a tension headache. This is a pain that begins suddenly, without warning, without any apparent cause, and engulfs your entire head in a matter of seconds. Such pain must be taken very seriously, especially after the age of 60, because in many cases, this is precisely how a hemorrhagic stroke manifests. Unlike an ischemic stroke, which results from a blocked blood vessel, a hemorrhagic stroke is caused by a vessel rupture inside the brain. This type of stroke is often accompanied by additional symptoms like nausea, vomiting, confusion, and even stiffness in the neck. The World Health Organization warns that such sudden and severe pain, particularly in older individuals, is one of the most critical and dangerous indicators of a brain hemorrhage. Many older people, unfortunately, make the mistake of thinking it's just a common headache. They take painkillers, try to lie down, wait for it to pass, and sometimes it does indeed pass. But the pressure inside the skull continues to build silently until it's too late to do anything. If you, as an older person, experience such an unusual pain, unlike any you've ever felt, do not wait for it to subside or try to rest. Seek immediate medical attention, because in such a case, time is not just valuable, it is the only thing that can save you. Sign number 6. Sudden confusion or changes in thinking. You might be talking normally and suddenly lose your train of thought, forgetting what you wanted to say, misunderstanding others, or starting to act strangely, as if you're somewhere else entirely. This sudden confusion, especially without a prior diagnosis of dementia or Alzheimer's, can be one of the most serious signs of a stroke. Unfortunately, this is also one of the most overlooked symptoms in older age, as many believe that forgetfulness, slowed thinking, or incoherent speech are normal after 60. However, if this occurs suddenly, it might indicate the brain isn't receiving enough oxygen, and a stroke is already developing, particularly in areas responsible for speech, memory, and consciousness. According to the European Stroke Organization, such an abrupt change in mental state is present in many diagnosed cases each year, primarily in individuals over 65. It's often mistaken for fatigue, dehydration, or early signs of Alzheimer's. But there's a clear distinction. A stroke manifests abruptly. An older person feels normal, and within minutes, they might be unable to maintain a conversation, recognize faces, or think logically. If this has happened to you, even if it was brief or everything normalized afterward, do not ignore it. What seems like a simple memory lapse could be a critical signal from your brain indicating serious danger. In older age, any sudden changes in thinking must be taken seriously, because with the brain, you don't take risks. You care for it, and you care for it urgently. Sign number 7. Sudden numbness or tingling on one side of the body. If you are over 60 and wake up feeling numbness in any part of your body, an arm, a leg, or even half of your face, accompanied by tingling, do not dismiss it as a normal sign of aging. Often, such sensations are attributed to sleeping on a limb. However, if the tingling appears suddenly and only on one side, especially in older individuals, it could be a critical warning that blood flow to the brain has been disrupted. In older age, even minor discomforts are often perceived as normal. Yet, according to the World Stroke Organization, localized numbness is one of the most underestimated early symptoms in people over 65. It often appears when getting out of bed or in the middle of the night, when blood pressure is unstable and the brain is not yet fully awake. The danger lies in the illusion that tingling might subside in a few minutes, leading to the temptation to ignore it. But each such episode could be a transient ischemic attack, indicating that this part of the brain is on the verge of a full stroke. Therefore, if you notice sudden numbness or tingling on only one side of your body, do not wait for things to normalize. Seek immediate medical attention. In older age, every minute is crucial to avoid severe consequences or a life-threatening situation. Recommendations: should any of these symptoms appear, the first step should always be to contact your primary care physician. It doesn't matter if the symptom passed after a few minutes or seemed mild. As in older age, there are no harmless symptoms when it comes to the brain. Ideally, an older person should be under the regular supervision of a specialist who knows their medical history, can objectively assess stroke risk, prescribe necessary examinations, and provide individualized prevention recommendations. Controlling blood pressure is also of key importance. Hypertension is one of the main causes of stroke in older age and must be regularly monitored. If you are taking medication to lower your blood pressure, strictly follow the prescribed regimen and never stop treatment on your own. Another important recommendation is to care for your circulation. Stay active, even if it's just light walks or daily stretches. This helps improve blood flow and reduces the risk of blood clot formation. Nutrition also plays a crucial role here. Avoid excess salt, unhealthy fats, and excessive alcohol consumption, instead prioritizing natural foods rich in potassium, magnesium, and antioxidants, as these protect your blood vessels and heart. Finally, and no less importantly, it is essential to listen to your body. Many older people become accustomed to enduring discomfort and ignoring mild symptoms, thinking they are just a normal part of aging. But in reality, these are signals, and the sooner you react, the higher your chances of avoiding serious consequences. In older age, the secret lies in constant vigilance and the decision to take care of yourself every single day. Therefore, please share this video with those you love, with your parents, grandparents, neighbors, or friends. Sometimes, simple information can save a life. And if this video has been helpful to you, remember that caring for health in older age begins with knowledge and with the decision not to accept suffering as something inevitable. I wish you robust health, and I look forward to our next discussion.